talking.
Dr. Rasmus Larsen, thank you so much for joining me.
Thanks for having me, Tim.
Absolute pleasure. You are an associate professor of forensic epistemology and science philosophy or philosophy of science at the University of Toronto. And you recently wrote a book, Psychopathy Unmasked, The Rise and Fall of a Dangerous Diagnosis. Fascinating book. In it, you propose some very interesting ideas. Primarily, you challenge some of the most widely accepted sort of definitions and terms and ideas around psychopathy, mainly that psychopaths lack empathy, that they are uniquely dangerous or untreatable, they have distinctive brain differences. Before we get to that and those ideas, why don't we start with base principles? But my first question for you is, what is forensic epistemology?
I get that a lot.
Yeah, I bet.
So forensic epistemology is probably best to just start with how it's two words, right? So epistemology is the study of knowledge. So what constitutes knowledge? And so epistemologists, they study that. So science, of course, purports to generate knowledge products. And so epistemologists, they kind of specialize in analyzing science, if you will. So the forensic component is how can we apply knowledge in legal settings? And how do we do it right? And what are the signs of when we're not doing it right? So my specialty, if you will, is to come up with some principles and ways to also teach students to how we should apply science in legal settings.
Very interesting. When did you, or how did you first get interested in psychopathy and the issue of psychopaths?
It's a long story. It goes back to my graduate years as a philosophy student, actually. So my background is in philosophy, and it must have been around 2012, maybe early 2013 or something like that. Of course, I was always, like ordinarily interested in psychopathy or the idea of psychopaths.
Very popular thing.
Are,
yeah,
right?
Sure, absolutely.
So I think I caught that bug like very early on, as many others do. But as a philosophy student, I was particularly interested in moral judgments. So what is it that goes on in the human mind when we make judgments about moral issues? Is there something special about them, or is it just ordinary practical judgments, so on? So what I started to observe in this literature is that there was a lot of talk about psychopaths because they seem to be this curiosity of individuals who seem to not have that capacity to make moral judgments. At least that was how it was presented. So I started to just read more and more about that. And one time I came across a book by Robert Hare called Without Conscience, a very popular book written in 1993 or published in 1993. And I was just hooked. This was just what I wanted to study. Very remember it. It was, I bought the book. I think it must have been in like the fall. I was flying from New York City to Copenhagen, and I bought the book in the airport and just read it on the plane way there.
Interesting. Now, your book, The Rise and Fall of a Dangerous Diagnosis. Why don't we focus on the rise for a second? Where did this idea of psychopathy or psychopaths come about? Because it is something, I mean, if you ask just anybody on the street, they can clearly, or they can point to people who they think are psychopaths in popular culture, popular media, but this wasn't always around. Where did it first sort of pop up in the literature?
So the idea itself dates quite far back, and there's not very good scholarship on this. So, for example, there's never been a thorough scholarly historical analysis of the concept. The best resource we have for the best book out there is actually a PhD dissertation from Sweden,
really,
from 1978.
Really?
Yeah. So, but at least what I've been able to track in my own research is I see the concept at least creep into the written literature in 1786. It's also a point where the mental health research, or it's a little bit silly to call it research because there wasn't much empirical research back then. But at least like the mental health, the way people talked about mental illness was very much dominated by, there's only one type of mental health issue, and that is really when you are psychotic, meaning that you have problems with hallucinations, delusions, that you are quote unquote insane, or
the extremes.
Right? Yeah, the extremes, right? So there's no concepts of, major depressive disorder or ADHD. That was like far later in history, right? So there's this speech that is by a person named Benjamin Rush that is given at the Philosophical Society in Philadelphia in February, as far as I recall, in 1786. And he talks about a condition. He calls it anomia. And I don't want to go into the Latin meaning of that, but he's basically trying to articulate that there are these patients that he has come across who seems to be completely normally functioning. They're intelligent. They can know math. They can be very smart. They can even be charming and so on. But they're just completely lacking in their kind of understanding of moral values or human values, broadly defined. So he would say that in this condition, people seem to have lost the ability to distinguish between right and wrong, or choose between right and wrong. And he comes up with a couple of examples of people who were just like really smart and intellectual and so on, but they just don't seem to know what morality is. And it kind of just finishes there, right?
Right.
And Benjamin Rush's speech gets written into text, and it gets distributed across mental health, circles in Europe and North America. And it becomes like a text that is kind of read like widely, probably also in France and Germany. But then, the idea kind of like snowballs from there.
So at that time in the late 1700s, how much of the study of mental health had anything to do with the supernatural? Because there was a time when these maladies or these abnormal ways of thinking were pinned to some sort of supernatural thing. I'm thinking the Salem witch trials. Was that over by that time?
No, not at all. That there's always been. Well, we should be careful. It's not just mental health research that has had, those tendencies.
Oh, no, of course. Yeah.
Before science becomes science what it is today, before it became like strictly empirically informed and so on, right? So there was always that element to it. But so the mental health field, which is like, well, we probably, if we look back today, with really good hindsight, it's just a wild west. Like, like not many actors, also not many intellectuals dealing with it, and many that were dealing with it, they were pretty much just like giving you armchair speculations. Some of them would work in at hospitals where mental health patients were pretty much people that you locked up in the basement and threw away the key, right?
Right.
So those are the sort of people that you're dealing with, and they also, funny enough, had all sorts of proclivities with.
Sure.
I mean, for example, a person who became kind of influential in the 1800s in Italy, Cesare Lombroso, in this field with psychopathy research. He was like known for having, what do you call it, seances where people would meet and they would call upon spirits.
Right.
That was always like this funny element to this, but I wouldn't necessarily say this just, with psychopathy research or mental health.
Right. So in preparation for our discussion, I'm not an expert in psychopathy at all or mental health, but it's a fascinating topic that everybody sort of has a draw to, right? I came across something that I'm sure you are familiar with, and that's Philippe Pinel, who defines psychopathy very well: mania without delirium, or madness without confusion. I think that sums it up very, very well. Now, how do we define? Or how, maybe not we or you, but how is psychopathy defined today as it stands?
Yeah, so there's different stories out there, right? So I personally don't think it has changed that much, and I can give you the reasons why I don't think it has changed as much. Of course, the label has changed, but the way it's defined hasn't switched that much. Recall that I mentioned Benjamin Rush, who said, well, it's a condition where people have some sort of like abnormality or dysfunction in comprehending human values or morality or something like that. That central premise pretty much stays the same all the way into the modern era. So when you look at the contemporary field, which was shaped by individuals like Hare Psychopathy from the United States, from Georgia, United States, or David Licken, very prominent psychologist from Minnesota, I believe, and then also later on Robert Hare,
who's a Canadian.
That's right, psychologist. They all kind of agree that this has something to do with lacking emotions, and therefore, because you lack emotion, you have no conscience, no empathy, and therefore you also don't really comprehend moral values. So you see, it's kind of the same thing, right? But of course, that doesn't mean that it stayed the same thing throughout the history. Because a lot of people would argue, no, there's a little bit more like this and a little bit more like that and so on. But the way, just to go back to when you mentioned Philippe Pinel, he mentioned that there is this condition. So if you read his book, I don't suggest you should, but if you go back and read, so he was one of the first ones to actually build what you call a nomenclature, a vocabulary of different mental health diagnoses. This is early 1800s. And he has this category that he calls a manie sans delirium, and or a mania without confusion or delirium, right? Like so the idea is, as I said before, you can seem smart as a whip. There's nothing wrong with your cognitive faculties, but there's just something off about you.
Right.
And his student, Philippe Pinel, which is Dominique Esquirol, which becomes a very influential psychiatrist in France. He comes up with a term that's probably a little bit better. It's called monomania. So one thing wrong with you, mono and mania, right? So he suggests there could be a lot of things that are monomanias. For example, you can have problems with your mood, but nothing else. That would probably be something we recognize as major depression today, right? So he also had this idea that can be something wrong with, you just don't comprehend human values. But everything else is fine, right? And this idea kind of survives all the way up to Hare Psychopathy, Robert Hare, David Licken, and so on.
Right.
It gets more sophisticated. Talk about causes and all those things. Back then they would say, it's because there's something wrong with your cranium, or you have been eating the wrong food or something like that. Like, crazy stuff, right? There's no empirical backing, and it becomes a little bit more sophisticated, the speculations about what causes this.
And so I think, again, if you were to ask a layperson on the street about psychopaths, I think, if I had to guess, the one thing that they would point to is that they act on this mania and violently, or that they're criminals in some way or another. And that's interesting because it then brings the study of psychopathy into the legal system. Right. And then that's something that you touch upon in your book as well, because it oftentimes results in longer sentences. It has it implicates or it gets involved in corporal punishment. Not corporal punishment, but death sentences, capital punishment.
Yep.
Pardon me. So it can be used in a legal sense, which is, I think, unique for diagnoses. Are there any other diagnoses that have such an impact in legal sentencing?
I mean, yes, there is in many different ways, but the psychopathy diagnosis has like a very unique type of impact. Usually when we use mental health terminology, so diagnostic terminology, right, is usually because we kind of want to help people, or we believe this diagnosis can be useful information in terms of finding out whether should this person be punished or should they actually be put in civil commitment for treatment and so on. Psychopathy diagnosis, so psychopathic personality disorder, seems to be used almost exclusively as some sort of aggravating sort of information, right, to the person who carries the diagnostic label, right. Which seems to be all sorts of problems with that. But of course, we can get into the weeds of how that works, right? But no, there are all sorts of mental health diagnoses that are used in the legal system, but they all seem to serve different purposes, at least, than psychopathy diagnosis.
Right. So the diagnosis such as this is almost like a multiplier in terms of I
would just say like a form of aggravating information, right? So gotcha. We have to imagine that, you know, people who go through the justice system because they have committed a criminal act and being sentenced for it, there are all sorts of decisions that are made about them throughout that course. You know, where should they have a prison sentence, or should they be released back into the community? Right. If they go to prison, where should they go? Minimal or maximum security? Right. Should they have isolation cells? Should they be, you know, in solitary confinement? Should they be given parole later on? All these decisions rely on all sorts of information, and, you know, that includes diagnostic labels, and sometimes these diagnostic labels will be something like a psychopathy diagnosis, right. And decision makers will. So let's talk about diagnostic for a second. So the way you're describing it to me, at least in the historical sense, it seems very subjective. Some of the classifications or the symptoms, I guess you would say. So there was an attempt to make it less subjective, and that's what Hare did with the PCL. Yeah. So how is it diagnosed today? What is you walk into a clinic, you may have committed a crime. Somebody might suspect there's something wrong with you. What is done to diagnose psychopathy? So maybe it's helpful to like just back up a little bit and maybe give all the details on this, because it's a little bit of an area of confusion often, both sometimes even among researchers, but it's probably for good reason, because it is kind of confusing, because there's many different authorities on what counts as a mental health diagnosis. They're different. You know, there's something in the American Psychiatric Association called the DSM. Right. There's something in the World Health Organization called the ICD, so the International Classification of Diseases. Those are two different approaches to these diagnostic labels. So when we say psychopathy, we typically refer to it. So here I'm talking about the branch of researchers I'm part of who study psychopathy as a personality disorder. You will hear a lot of people, you know, lay people use the term psychopath for all sorts of different things. Right? Yes. Yeah, it gets tossed around really easily. Yeah. Oh, my friend, you know, Tim, is such a psychopath. You know what he did the other day? Like, that's not what we're talking. We're talking about a specific personality disorder. Yeah. Personality disorders is a type of diagnosis we have in these manuals. Okay, so such as the DSM-5 and such as the ICD-11. Now, it's a little bit complicated because historically, for example, the DSM no longer calls it psychopathy. It calls it antisocial personality disorder with psychopathic specifiers. That's a long thing to say. Okay. So we just say psychopathy, right? Psychopathy research. But there's also a little bit of controversy here. So some psychopathy researchers think that the diagnostic category in the DSM is too broad and want a much narrower definition of it. This is a long debate that goes back to the 1990s and is a little bit tedious and boring. What is a little bit more helpful is just to think about how is it actually used in practical settings, because that's really all that matters, right? Yes. So the way you're being diagnosed with psychopathy, officially, that might be written into your clinical record. They have antisocial personality disorder with psychopathic specifiers. Or some clinician might just write psychopathy or psychopathic personality disorder. Okay, that's just like terminology here is not so interesting. The way that you would typically proceed, though, if you're a clinician, so here in this case, for example, a forensic psychiatrist, right? So you would have, let's call him Tim, and he has done something really bad, and he's now just as involved, like he has committed some assault or something like that. And Tim will then sit in front of a forensic psychiatrist. Perhaps it could also be a forensic psychologist for that matter. And Tim will go through all sorts of assessments. These are, structured interviews where all sorts of, information is written down about Tim, right? But one specific assessment that clinicians like to use when they are diagnosed with psychopathy is this checklist that Robert Hare came up with in 1980 called the Hare Psychopathy Checklist, or the PCL. This one gets revised in 1991, and so that's why we call it the PCL-R for revised. And then it gets published in his latest edition in 2003, which is just the second edition. So this checklist consists of 20 items. So you have to imagine a list of all sorts of items. They're roughly like half of them are like related to personality traits, and the other half is like to concrete historical past behaviors of the person. So you will sit down with the clinician and they will score these items 0, 1, or 2 points. So on a 20 item list that yields maximum 40 points. If you score 0, you're probably your grandmother's favorite, but most people don't, right? So the subjective element is still there, because you have to make a discernment of whether Tim has some of these personality traits. It's a really tricky thing to do, by the way. But it's still made some sort of like more controlled process, because you have the checklist and everybody is now doing the same thing. So whether Tim speaks with the forensic psychiatrist on duty in the morning or the other one who's duty in the afternoon, they're trying to do roughly the same thing, right? That's at least the idea.
Right.
So the idea is that if you score high enough on this checklist, so from 0 to 40 points, if you score somewhere around 30, that's evidence for the clinician to say, I think Tim might have psychopathic personality disorder. And then they will cite that as evidence for their diagnostic claim, right? These PCL-R assessments I should probably put it that way, should take a long time to actually conduct. There's a little bit of a troubling tendency in the system I've seen PCL-R assessment made, with very little interviewing time.
So would you say it should take long? You're talking days or hours?
I've heard serious psychologists say it should take many days.
Okay.
Because you have to plow through all the information you can find about Tim, and you also have to interview Tim, probably more than one time. And ideally, you should also have more than one psychologist or psychiatrist who does it, so you can kind of come to a consensus, right? That's how it's done in a reliable way, right?
Interesting.
It's not necessarily how it's done when we go out there in the weeds in the field, because, resources are scarce.
Of course.
But that's a different story. If you use it properly, as Robert Hare intended, you're supposed to dedicate a long time to this. And the scoring system is supposed to be like a line of evidence to when you can diagnose this personality disorder. There are different tools out there. It just happens that Robert Hare's is virtually the only one that is used in clinical settings. It's referred to as the gold standard. There are also not many clinical tools. There are a lot of self-report tools. They are not necessarily used in clinical context. It has to be like a clinical interview, right? So the PCL-R has just become this almost one and only tool people use to inform their diagnostic decisions.
So give me an example of a question that might be on.
So the PCL-R is supposed to be a semi-structured interview. So there's not necessarily supposed to be like strict questions you're supposed to ask the person. So it's not like that there's a strict interview protocol, but you have these items. For example, lack empathy. That's one item, for example. So the challenge here is for the clinician to figure out, well, does Tim lack empathy? Well, let's talk about how he feels about his victims. What's his relationship to his siblings? And, so you have this conversation and kind of track information.
So it's up to the clinician to find a way to tease out whether that item exists or doesn't exist.
Yes, that's the subjective element, right?
Gotcha. So
now there's also an item called revocation of conditional release. Well, that's pretty easy to score, because either you have you have violated your conditional release, or you haven't.
Right.
So those are the more like hardcore, like those are we often refer to those as more reliable items to assess. Where something like lacking empathy or grandiose sense of self-worth, right? Like that's pretty hard to do.
Right.
So clinicians typically don't. They are very hesitant about those more subjective traits. They don't like them. If you do surveys on clinicians, they don't necessarily like to score them, but they have to, right? So, but also why you see there's a little bit of discrepancy when people score people on this tool.
Are people who are being interviewed or speaking to a clinician doing the Hare checklist, have they always, I'm sure the answer is no, committed a crime? Why might somebody find themselves sitting in front of a clinician to go through this checklist? Is it usually because they committed a crime, or what's typical?
So this is me speculating because we don't have good data on this, right? But I think it's safe to say that in the vast majority of cases, the person is just as involved in some way or the other. It might not be that they have committed a crime, because it could also be a person who's under the age of majority, for example. So, so it could be all sorts of. But usually, we talk about a person who's, if not just as involved, then at least, involved in the with some social institution of some kind, right? And they go through all sorts of assessment batteries. Some institutions will have an assessment battery if they have some. And so when I say an assessment battery, it means that there are a lot of different assessments that a clinician will use. Some institutions say, whenever we have an intake, for example, of a person who has been sentenced to, say, serve a prison sentence, then there's some institution will have intake batteries where they have to see a psychologist, and then they have these assessments that will go through. And PCL-R might be one of them, right? Usually the PCL-R is something you fish out of your bag because you're sitting in front of a person who's been just as involved or often committed something criminal. And there's also a little bit, something that should be said about that is that a lot of the items on the PCL-R, if you haven't committed anything criminal, you're unlikely to score high on the tool, right? So it doesn't make much sense for you and I to sit and get a PCL-R score, because we're never going to get to that diagnostic threshold simply because the items include criminal behavior. I don't know about your criminal background, but I'm assuming it's fine.
No, below 30, but I'd score below 30, I think. Yeah. That's very interesting. So, why do you think we've become so obsessed with this idea of psychopaths? I mean, you're obsessed in an academic sense, but culturally speaking, it just seems, every other book, every other movie, every other series is about a psychopath.
Yeah.
Why do you think that is?
Yeah.
I mean, it is interesting.
Yeah.
But do you have any insights?
I don't know if I have any insights, right? But I'm happy to speculate.
Please.
But it is one of those questions where, my guess is probably as good as yours, right? It's this is, science can't give you the answer, at least to this. But I can highlight some things that, listeners might find interesting. So the idea itself was not like an object of widespread cultural fascination until relatively recently, right? So, but something happens around, just to put like a rough number on it, somewhere around the 1970s. Something clearly that seems to be a shift in popular productions. Maybe it has something to do with films become cheaper to produce, and there's color TV and so on. So maybe you can dramatize things a little bit easier.
Interesting.
There's also something happening in North American culture, at least, that you see serial killers pop up. People want an explanation of that, right? So
Manson about that time.
You have that time. But probably something that I often highlight, at least, is that you also have a person like Ted Bundy, which in later years becomes the person that almost all psychopathy researchers will refer to as the quintessential example of psychopath, right? So it happens, we can get into the details of it, but it happens to be that's probably not a good example, but that might shock some listeners, but there's all sorts of clear reasons why that is. But the thing with Bundy is that he's such a, not in a good way, but he's such a cultural icon in the late 1970s in North America, because his legal case, which started in 1978, I believe, was the first homicide case to be prosecuted on live television. And it was such a, farcical event, but it draw a lot of, it captivated a lot of people. People came to court. There was a national thing, right? And here on live television, you have a person who's standing in front of you who has, as Benjamin said, seems to be smart as a whip, and he even he's charming. Like there was all sorts of like, there's these narratives about women coming to court because they wanted to like, get a peek of Ted Bundy and found him charming and whatnot. Whether that's the case or not, I don't know. But he seems to be, everything is fine, except he also slaughters a lot of people for seemingly no reason, right? Mm-hmm. And so here you have this real living case right in your face, right? It's not a movie. It's real, right? So I think this must have had some sort of effect because I can also, so just to like relay some facts here. So that's one fact, but you also have to remember, and this is a very often forgotten fact about psychopathy research. In the 1970s, this was not something psychiatrists took seriously.
No, in your book, you referred to it as a wastebasket diagnosis.
Yeah, it was a diagnosis that was extraordinarily controversial. Like, prominent figures in psychiatry would say, this is just like, forget about it. This is just like this wastebasket diagnosis, they would call it. It's just like a label that you have come up with because there's certain people you don't like. There's nothing wrong with them. They're just being, they're just being idiots, just being like bad people, but there's nothing wrong with them, right? Mm-hmm. Like it's you're stretching the confines of psychiatry, something that should be none of your business as a professional, right? So there was all this controversy around that diagnosis. You also have Hervey Cleckley, who becomes the most influential figure in contemporary psychopathy research. You have him say in the last edition of his famous book, The Mask of Sanity, which was published in 1976, you have him literally say in the foreword that he is like a voice crying in the wilderness. Like his colleagues don't want to listen to him. He's like, he's distraught and very unhappy that nobody's taken his work seriously. He was a very influential figure in other respects, Cleckley, but with psychopathy, he had a product to sell that nobody wanted to buy, right? So, but then you have Ted Bundy come up, and all of a sudden there's just like, there seems to be something going on there. And there's like, something happens. You also have, as I've talked about, sorry for going on about this, but I think it's fascinating.
Absolutely.
Because it allows us to speculate with no consequences, right? But you also have the fact that there's a get tough on crime movement going on in North America. I think that also, so you also have resources being redistributed to combating crime. And then you have, psychologists and psychiatrists saying, hey, there's this idea about psychopathy that could be this, fantastic way of making sense of crime. How about funding our research, right? And then, you can see there's a lot of like vectors that kind of push
right. So when you brought up Ted Bundy, you mentioned that he's sort of the mascot of psychopathy at the time, but you said maybe not so much.
Yeah.
So my question is why do you say that? And high profile cases such as his, how well does it actually fit the scientific claims?
So it might sound controversial for me to say that Ted Bundy is not a good example of psychopathy, but I honestly, and I really mean this, I don't mean to be hyperbole or anything, but I really don't think it should be controversial. And there's a couple of reasons why. First of all, the classic notion or idea of psychopathy is supposed to be a person that, essentially has no emotions, right? Ted Bundy, like for all we know, that person was full of rage, right? Like literally, you can, if you read through his crimes in detail, they are just like extremely violent aggression, like to
passionate aggression
to the extent that human beings are capable of.
Right.
You also have clear cases like in court where and before the courts took place, that where he's just like clearly being aggressive and angry and so on, right? So we're not talking about a person without emotions. Already there, it kind of falls apart a little bit, right? But one thing that is often overlooked, I think, is that there are many ways you can make sense of Ted Bundy's, really heinous crimes, by the way, but you can explain them. So it's you don't need to like grab onto the psychopathy explanation, you can just say, well, here's a person who was combating some really, really seemingly. So we don't know, all we have access to is interview, and we have never studied Ted Bundy scientifically, but for all we seem to be able to discern, at least, he's struggling with some very, very serious, violent sexual urges, right, that he cannot control. Today, we know that that's a thing, and you need therapy to actually deal with that, right, as a person. He never got that therapeutic help, right, for all sorts of reasons. So he's acting on some urges that he's not in control of. He's also relaying to family members that what you might interpret, again, this is speculation because we haven't studied him empirically, right? But he is relaying information that seems to indicate that he's struggling with delusions and hallucinations and things like that. So psychotic, not psychopath, or psychotic symptoms, right? And then you have, evidence of substance misuse, and then also just like a life that is spiraling out of control, right? He dips into doing, crimes in his local area, assault on women, and that kind of spirals out of control is a common pattern we see with individuals. It's something when they're dealing with serious mental illness, right? And substance misuse paired with homelessness, which is also the case with Ted Bundy. And then it just becomes unchecked, right? And he was just, he had an outward appearance as if, he could fake that everything was fine. And this is actually a common thing that people with cognitive dysfunctions, with serious mental illness, are sometimes able to do. You can sit in front of them and there's nothing wrong with you, but they're just so good at play acting and mimicking and showing you what you want to see in a social situation. So this is one way you can just make sense of Ted Bundy. You don't have to, go the psychopathy explanation, also because it's so easily falsified, right? Because of what I mentioned earlier.
Very interesting. So you mentioned sort of historically it peaked in the 70s and 80s for various reasons. One of them, like you said, maybe media, Ted Bundy.
Yeah.
So that's sort of the first part of your book, the rise and then the fall.
Yeah. So it starts taking speed in the 70s.
That's right. 80s. It picks up there.
Yeah, it picks up there. Yeah.
But you've done a lot of research, obviously, in writing this book and meta-analyses and reviews that it peaked. It peaked in the 2010s.
Yeah, so this is a little bit of new information that is not necessarily clearly expressed in my book. So
let's talk about the fall now. This idea of psychopathy.
Yeah, so you see things taking shape around year 1980, because that's when Hare publishes Psychopathy Checklist.
Yeah,
and it takes about 10 years before there's a research community that starts to build around that way of assessing psychopathy. So it's important for, anyone who's not familiar with mental health research. You need to have a reliable and what psychologists call valid way of assessing. So selecting people who are good representations of that thing you study before you can actually get a research program going, right? If everything is just like you're collecting apples and pears,
right? Yeah, just random.
It's just going to be noise, all of it, right? So it takes around 10 years or so, a little bit more maybe, before Hare has a growing research community around his scale, and that's quite an achievement. And he's also rightfully, I would say, hailed for actually doing a lot of really important work along this line, like just as you would do with mental health research. You have to do really serious work with developing these tools. There's a lot of really boring math stuff and so on that goes on in developing tools like this. A lot of testing, you have a lot of people involved in testing the reliability of these tools, right? So he does all that, footwork. And then in the 1990s, it starts to really pick up. And then it really picks up in the 2000s. And what I can discern from the research literature is that it peaks around 2013, the research output. So it kind of explodes. And then we start to see a dip. This is if a viewer or listener is just interested in seeing the evidence of this, they can just pick up any meta-analysis, systematic review on any domain or research paradigm within this field and just look at they can just take all the studies that have been listed in the systematic review, take the years and just do a curve. Like when are these studies published, right? You would see like a steep upward, a steep downward. That's going to be the pattern that we'll find. And that goes on in all paradigms and sub-paradigms in psychopathy research that is based on the PCL-R. So that happens around 2013, yeah.
Okay, understood. So let's get into the 5 core claims that you scrutinize in your book, which I mentioned a couple in the beginning of our conversation, have long been considered staples of the diagnosis of psychopathy.
Yeah.
Let's start with the first one, that people who are psychopathic are extraordinarily dangerous.
Yes.
Social predators, as an example. Yeah. That their recidivism rate is high. You challenge that.
Yes. So just to just key everybody in. So there are, of course, all sorts of different claims made about psychopathic persons or the idea of psychopathy. And some of them has been studied thoroughly, some of them less, and some has not even been studied, right? But so in my book, I single out 5 very common claims. Right. One of them is the claim that a person who is diagnosed with psychopathy is also going to be reliably and predictably much more dangerous compared to the person who does not have a psychopathy diagnosis. So this was a long-standing claim that goes back to the 1990s. So here we're talking about just explicitly a person who score high on the PCL-R.
Right,
the
above
claim
30.
is yeah, and therefore we take that as an inference that they have psychopathy. Leave aside all the of course there's sometimes going to be errors and all that, but that's how it is with all research. But anyway. A person who scores above the diagnostic threshold on the PCL-R should be, all things considered, extraordinarily dangerous compared or relative to the person who score below that threshold, right? So that's a long-standing claim. It's a claim that of course, ties together with the psychopathy concept, like they're supposed to be dangerous, right? So, but that's, as scientists, that's not really where we start. We start with the claim itself, right? So if you score high and I score low, if we measure me and you for 5 years, you should have many, many more criminal convictions than I have. That's the claim, right?
Makes sense.
Yeah. So very simple stuff. This is not rocket science, right? So fortunately, we can also just study that, right? So we can go into a prison and say, hey, who wants to participate in a study about, all sorts of things we come up with. And one of them is risk assessment. So we call these studies risk assessments. People sign up. What happens is that, you get a pool of participants, say you get 200 people, everybody gets a PCL-R score. They might get all sorts of other scores because we have all sorts of research interests when we study just involved individuals. Now, what we do afterwards, after we have given everybody a PCL-R score, is that we wait, because eventually most people have to either leave prison or they will be among other prison inmates. We can follow the behavior there, but usually we tend to follow their behavior when they're released back or reintegrated back into community, right? And sometimes we do that for a long time, sometimes shorter times, but sometimes we do it for, say, 2-3 years. Now, after 2-3 years, we can go in, in our databases in Canadian criminal justice system, and we can look up the people who participated in the study. And then we can see, okay, so did people recidivate? When did they recidivate? And so on. And then we plot that data onto, and then we see if there's an association or relationship between a high PCL-R score and criminal recidivism. And what we find there is that there is a relationship. It's just a very weak signal. What statisticians will call weak to moderate. Right. But I can give you just like a quick so we have done many of these studies in the field. So right now, I believe that there's somewhere around 230 studies of this kind. And which is it's a good evidence base. That's quite a bit, yeah, for sure. You definitely have enough evidence now to inform your question, right? So we can ask, is it true that individuals score high are much more dangerous than those not? And the way we typically set this up, there are different ways studies are set up and how they measure these things, but think of it in this way. if we take people who committed a crime, so we have this pool of, say, 200 individuals, there's going to be some people who did commit a crime within the time period, say 3 years, right? And those who did not commit a crime. So we can divide the pool up into those two groups, right? The difference in PCL-R score is roughly half a standard deviation. So if you have a standard deviation of, say, 6, that means that there's going to be, on average, a 3-point scoring difference between these two groups.
Right.
Now, you only get those numbers if it turns out that a lot of people score low on the PCL actually recidivate, and also people score high, right? So
that's right.
One business, right?
Yeah, yeah.
The effect size is so small, depending on what you're. Sometimes it's a little bit higher than half a standard deviation. Sometimes actually lower. So the sexual recidivism is down in the 0.38 or something like that, which is not very impressive. That's actually so low that you can't even detect it with your own eyes. Like if you had to, like, if you put up
plotted it graphically,
like, if you everybody put their PCL-R score on their T-shirt, big printed numbers, and you put people into two groups, those who recidivated and those who did not, you would not be able to look at them and say which has the highest.
Which group is,
you would need to actually make a spreadsheet. That's how small the effect is, right? There's much more to be said about this. There's all sorts of moderating variables, but now we're getting into the weeds. But this is the raw data before we even talked about moderating variables, right? So this is not very impressive.
Interesting. The other claim that you challenge is that psychopaths are chronically untreatable.
Yes.
Right. And these 5 claims that we're going to go through here, they're the ones that most people would point to. So it should make sense.
I should say that some people don't believe in all 5, but only 4. It doesn't matter. Like, it is like common claims in literature.
Common concepts and ideas that people have about psychopathy. So you suggest that perhaps it is treatable.
Yeah. So there's this idea that, and it's again an idea that goes. It's, as far as I've been able to detect, it seems to be an idea that starts to take shape in the 1900s, at least. Funny enough, when Benjamin Rush suggested that there was this condition, psychopathy back in 1786, he was actually doing it because he was promoting medical science as a way to treat this.
Okay.
So he was a man of medicine, not very good in medicine, but that was how they looked at it, and they wanted to kind of like help the world. Hey, what if medicine could help improve the morality of the human condition, right? That was kind of the idea. It's much later that people start talking about, hey, doesn't seem to be working what we're doing, right? Not on an empirical ground. It was just like speculation that so you have an individual like Hervey Cleckley who might be the one who really makes this view and this idea proliferate. Not necessarily because he was like dogmatic about it or anything like that. It's just that he had tried so much. So he had these individuals in his own care that he thought or he labeled psychopath, and he just claims that nothing ever works with them.
When was Cleckley active?
So he was active in mostly in the post World War II era.
Okay, so much later after.
But I think he does establish practice in the 1930s. It might be a little bit earlier than that. I think it's the 1930s. But yeah. So and he works at a hospital in Georgia, in Augusta, Georgia, the state. And so he claims to have had, dozens and dozens of patients under him, and nothing ever worked, right? So that's anecdotal evidence. It's not necessarily anything we should take too seriously, right? But then you have the idea starts to gain traction in the 1980s, and in the 1990s, you have researchers who really are proponents of this view. This jives a little bit with that there was a general tendency in forensic psychiatry or forensic psychology to believe that there was nothing you can do with people who were criminals. Like they were like, these are offenders with like capital letters.
Right. That's who they are.
Yeah. So we sometimes maybe jokingly, but I think this is actually used in publications also. We call it the nothing works era, meaning that, you were laughed at if you tried to help criminals, right? Like as if they were like some sort of unique population base that, you know, were completely out of reach, right? That's far removed from what we think today, right? Like that's not how we look at it, right? But you also have some empirical research that seems to really push this idea. So the core idea is that there's nothing you can do. There's like whatever behavior they will do in the future, there's nothing you can do today to help them not do that in the future, right? Like, so here we are often concerned with criminal recidivism, right? So we, in our modern prison system, for example, correctional system at large, we have all sorts of programs to help individuals not end up in this cycle of recidivism constantly. Some people have really powerful problems with, you know, with controlling their emotions, aggression, and so on. So we offer them courses how to do this, right? Cognitive behavioral therapy and so on. So now in the 1990s, if we go back in time, there was this idea that you could not help these individuals. And also, there was even also people who claimed that if you try to help them, you're just going to make it worse. You will teach them ways to, you know, if you enroll a person in a course that teaches them about empathy and the perspective of their victims, and they're just going to be better at manipulating. That was the mantra, right?
Right.
And it has kind of stuck, like, amazingly, I think. It's still something I see people say. Not so much in the sciences, but I see it. And I think we should be very careful here. There's just no evidence of this, that this is the case, right? Now, one study that did gain a lot of traction in the 1990s was a study from 1992, actually done here in Canada. And it was a study that was conducted not that many hours from Toronto here, in Penetanguishene, at a mental health hospital called Oak Ridge back then, today called Waypoint. And they had what was a separate unit at the hospital. It's called the social therapy unit. And they had a treatment program where they purported to specialize in psychopaths, right? And then they had this very, you know, today we look back and I think of this like very flip and really, really harmful program. But back then it was seen by some people as this novel way of treatment. And in 1992, 3 researchers, in-house researchers from Oak Ridge or Waypoint today, they take this data and analyze it, and they find something very amazingly, or to use the author's own words, I think they refer to it as the most surprising result they had ever discovered, or something along those lines. They found that the psychopathic patients, there were actually 2 groups that they had followed in this data set. There were psychopathic patients who did receive the treatment, and there were those who did not receive the treatment. Those who received the treatment had higher violent recidivism rates compared to those who did not receive the treatment. So this was taken as evidence that treatment does indeed make psychopathic patients worse, right? And the paper speculates, exactly as I said earlier, that maybe we, you know, taught them better ways at manipulating people. Although, jokingly, people have said if you taught them better ways of manipulating people, they should not end up in prison because then they're good at it, right?
That's a very good point. Yes, yes.
But anyway, that's just like an internal joke in the field. Nobody takes this study seriously anymore. I shouldn't say nobody because it's still cited less and less. My group has actually done a comprehensive analysis of this study. It's full of flaws, like really grave flaws, like flaws that, you know, my undergraduate students like instantly observe, like analytical flaws and so on. But one thing that is also the most glaring flaw is that the treatment program that they are purporting to analyze is not a treatment program.
I was just going to ask, what is it exactly they were doing?
They're not, like, it's very well known today. There was a major civil lawsuit that concluded in 2017. It turned out that the therapists in this program were actually torturing the patients. Right? So they were experimentally drugging them with all sorts of powerful psychotropic drugs. They were chaining them together. Patients would literally chain together naked. They had to there's something they would put in what they call a sense deprivation chamber that was lit 24/7 for up to 14 days, and they had to go to the bathroom together, had to sleep together while they were like on LSD and like terrible stuff. And literally one of the there are many dark chapters in Canadian psychiatry, but this is definitely one of them. What bothers me about this story is also that the producers of the authors of the 1992 study, they were fully aware that this was the type of treatment or quote unquote treatment that they received. Still, they published it. Reviewers were probably very well aware that this violated all sorts of standards. It still made its way through. What compounds the bad part here is that this study has still not been retracted, for example.
Really?
Yeah. It's still being cited. It's one of the most cited studies of psychopathy research.
That's interesting.
Yeah.
I'm sitting here listening to you describe this study in this paper, and, the actual impact it has on people's lives. For example, I know there's the one well-known individual who was involved in the lawsuit.
Right.
And, it's so different than what the sort of research that I did, the research, if I mess up or if my study is wrong, it's molecular biology and it doesn't really have any impact on anybody's life, broadly speaking. But something like this is just remarkable that it could slip past reviewers like that. It's disgusting, really. Yeah. It's brutal. So then what evidence is there to suggest that psychopaths can be treated?
Well, there's scientific evidence. So we have done empirical studies. There's also just like trivially true evidence in the case that we know that if we just select random people from a correctional facility and offer them really high quality, what we sometimes refer to as a little bit derogatorily as rehabilitation programs, but they're just like attempts to help individuals. They just have a broad effect on almost like most people who go through them willingly and so on. They usually have some sort of effect. Since not the majority, but a good third perhaps of the prison population score high on the PCL-R, it's just like completely unlikely that the only ones who do not benefit are only the people who score on it. So it's just like, so the sweeping claim that treatment doesn't work, that's just like trivially false, I would say, right? But we have, of course, also just studied this empirically in a systematic way. And the way we do it is just to, again, take a cohort of individuals, and then we offer them whatever program we have on offering at the correctional institution. And then we compare the recidivism rates, for example, of these individuals compared to random selected samples that did not receive the treatment, right? And then sometimes we have then also given everybody a PCL-R score, so then we know, right? Right. And, people with a high PCL-R score seem to benefit from these, right?
Understood.
And I should say, though, that cognitive behavioral therapy and group therapy, as is usually the ways to go, they have limited effects on anyone because, especially when the outcome that we are measuring on is something like criminal behavior. Criminal behavior is a very complex type of human behavior. It's not just something you can sit down with therapists and then magically resolve. Sometimes, people push you into crime and you have no say. Sometimes,
that's right.
Yeah, there's all sorts of, this is a very complex
variables.
Yeah,
yes,
so,
yes. Okay, the third one here. Psychopathic persons lack moral capacity, empathy, moral reasoning.
Yeah. This is, it's almost like the core claim of psychopathy, right?
Right, exactly.
If you remove that one, you don't have anything.
Right. It's the as Pinnell put again, mania without delirium.
Yeah,
and that would be the mania.
The
I
mania
suppose.
Is that you don't live up to standards of human values and don't comprehend them.
That's right.
Yeah,
that's right.
So if you pick up Hervey Cleckley's The Mask of Sanity, or if you pick up Robert Hare's book Without Conscience, is a much more digestible is almost a pamphlet compared to Rick Lakesley's book. If you pick up any of these two books, they will give you the example that psychopaths are morally colorblind. They both use that analogy. They can learn, just like a colorblind person can learn that the top light is, wait, which one is green and red?
Red at the top.
Red at the top.
Yeah.
They can learn that red means stop and green means go.
Right.
But they don't know the qualitative details or, put behind those
top
colors
is stop, bottom is go.
Whatever. It's just like some abstract rule, right? But they don't have the same feel for red or green as you and I do when we can perceive colors, right? So this kind of same analogy this is an imperfect analogy, but it's at least an analogy that I think people can understand, right? So the claim is that they're morally colorblind. So when I tell you, you cannot, murder, to you, that's not just a rule. You understand that if Canada changed the law tomorrow, so it's now legal to murder, you would still not feel very well murdering, right?
Right.
So the claim is that to a psychopath, that would just be like, all right, now it's
open season.
I don't understand why. It's kind of like the rules of trivia. They could be different. I don't care. There's no deeper meaning why the rules are the way they are. That's kind of how Cleckley and Hare describes this idea of. So they also have more details that therefore they also don't have empathy, and that's kind of the part of the problem. They don't have emotions. So when you feel sad, I don't really know what it is, that facial expression you have, because I have never felt sad, so I can't mirror those emotions. That's the claim. Right. It's a fantastic claim, by the way, but it's nevertheless a claim. Even people that we, there are other diagnoses where we think people have a very hard time discerning emotions, as autism and so on. But even that is much more nuanced than that, right? So the old story about psychopathy is this full scale, no emotions, no empathy, no moral values, right?
Which I think makes sense to people, because without empathy or emotions, it's very easy to move to the next step, which is I commit this crime.
Yeah, right. It's an explanation that makes good sense in this, not to make it sound derogatory, but it's very glib sense and understanding of human nature, right? Like we can say, all right, I suppose theoretical, conceptually in the abstract, it would make sense, right? But if you really start thinking it through, biologically, can you imagine an organism without emotions? How would that even look like? You're back to, the donkey that is stuck in the middle between, two stacks of hay.
Right.
It's not a thing. If you don't have emotional impulses, you're flat on the bed and you're not going anywhere, right? Like that, we have certain conditions like that. It happens with strokes and so on, where people really, it's enormously debilitating. It's not a thing in ordinarily functioning human beings. So just with some conceptual criticism, it already starts to fall apart. But we're scientists, right? So we want to study this empirically, right? So again, what we do is we take people with a psychopathy diagnosis and people without, and then we do all sorts of things. We ask them about, would this situation be permissible to do so and so? So we have these classic moral dilemmas, for example. We ask them about, maybe psychopaths are more inclined to utilitarian moral judgments instead of deontological. Maybe they are not prone to when you do emotional manipulations with the moral dilemma, such as, for example, most people probably heard of trolley problems.
I was just going to bring it up. Yeah.
So there's a version of the trolley problems where you have to push, instead of switching the levers, so the train goes off and killing one person instead of the 5. There's a version where you push a person off a bridge.
That's right.
Right. So if you truly is a psychopath in this conceptual sense, it shouldn't make a damn difference to you whether you pull a lever or you push a person, right?
Right.
But it turns out that they responded exactly the same way as other people.
Interesting.
So again, there's a little bit of the same pattern without going into it. There was some early studies from early 1990s where there was some evidence that there was some moral, cognitive, and, problems with empathy in this psychopathic population. But, it was just followed by like a swath of studies that showed that there's just no difference. Like there's no discernible difference between people with a psychopathy diagnosis and without in these judgments.
So why do you think this one sort of criteria has stuck so well in clinics and as well in popular culture?
Yeah, it has certainly stuck in public culture. I'm not sure it would be fair to say that it has stuck among clinicians, though. So again, we don't have good data on this because, you know, we usually have better things to do than surveying clinicians about their future these days. Yeah. When you do when you do survey practitioners, but there's a couple of studies out there, not many. I can think of 3 or 4 or something like that. When you do survey on them, they do indicate that like a lack of empathy is like a hallmark of psychopathic patients, right? But you know, these surveys are so like, they're so superficial, right? So what do you mean? Do you mean that they just like, they did not have empathy for the victim of their crimes? Or do you mean that they have absolutely no capacity for empathy, right? Those are two very different things.
Yeah.
We like, I don't think it comes as a surprise that we have very selective empathy. Everybody has selective empathy, right? Like it's, so is that just what we're talking about? Or so Cleckley and Hare said that there's no capacity for empathy, right?
At all.
So yeah, it's just not there. Right. It doesn't exist. They don't even know what you're talking about when you say empathy, right? That was that's the old mainstream version of the story. Today, you would probably see clinicians say, no, that's probably not true. What a lot of people, I think, in the researchers, not necessarily clinicians, but the researchers, I think a lot of them fail to realize, sorry for generalizing in this sense here, but what a lot of them, at least when I meet my colleagues at conferences, that if this thing falls, that you concede that the people we diagnose with psychopathy have ordinary emotions and have ordinarily functioning empathy, there's nothing else left. What is supposed to be abnormal then? You know what I mean?
Yeah, like they're just bad people.
What do you? Yeah, I mean,
if they've committed a crime,
are we just talking about bad people? Well, welcome to the planet Earth.
Right.
There's plenty.
Right.
There's more. There's more than those. You know, classically, psychopathy research would say that 1% of the population are psychopathic. If we're just talking about bad people, I think we need to go a little bit higher than 1%.
So 1% is the
it's estimate, kind of like taken out of midair.
Yeah.
I mean, there's some studies that claim to have a method. I don't think it's a very sophisticated method. But
so what about the idea that psychopaths have different, they're biologically different.
Yeah.
Whether we're talking about hormones or genes or brain structure and function.
So that's a claim that was around ever since psychology and psychiatry moved away and out of this whole psychoanalysis era from the 20s and 30s and into more empirically informed area of study. People obviously wanted to involve some sort of biological measures, right? To verify their claims about mental illnesses generally. So with psychopathy, that quickly became a thing as technologies became more and more sophisticated, more and more types of studies ballooned out of that, right? So, some of the early ones was like karyotyping, which you probably know way more about this than I do with your bio background. But, you were basically just looking at chromosomes, I suppose, right? And, try to search. Of course, you didn't find anything. And
no, I wouldn't tell you anything.
But, it was, whenever new tools invented and is being tested.
Sure. fMRI now, I would imagine.
That's where we are today, right? We have more and more sophisticated brain scanning, as it's colloquially called, brain scanning technologies, right? Where we can look at a living brain to see what is going on, at least get some information about what's going on, right? So these are the types of studies that they're probably most of is the neuroimaging studies. So they use something like EEG early on in the 1990s, 2000s. And then today, in 2000, I think we had the first MRI study. And then, of course, the number of studies proliferated over the 2000s and early, 2010s, right? And these studies are, they're incredible methods. They're really fascinating technologies,
Yes.
MRI scanners, right? So magnetic resonance imaging. And we don't have to go into the details of how this works, but essentially what we do is that we put people in a machine with a very powerful sensor, and then we give them all sorts of tasks. That would be a functional study. So we see if their brain is seemingly activating different areas compared to other people, right? So the idea would be that if you put psychopathic persons in the scanner and compare them to non-psychopathics and give them the same task, if we find differences in their, brain mechanisms or functions, that might be some evidence to suggest they have different brains, right? You can also do a structural scan. So are their brains structurally different, right? So these studies have been done probably around 100 studies. I would say that's at least what the systematic reviews are suggesting. I have a sense that there are more out there, but the systematic reviews, they will tell you something like that, 100 studies. And what you find is that results are just like literally all over the place. Okay, so there's no consistent pattern that has been found. And then, I've heard this, counter argument or get back to me kind of like, but you did find something, right? And what people have to understand is that when you put a person in their brain scanner and compare it to another person, especially if your samples are small, you're going to find something. Like, there's so many confounding variables in these studies.
Sure.
Like, what if you had a concussion when you were 6 that you didn't report to anyone? Like, are you controlling for that? What if you're on medicine, and here we're talking about justice of all population? What if the person is like flat out drunk? But didn't tell you, because why the heck would they tell you, right? All sorts of confounding variables are going on. You are going to find something. Now, that's fine if we have enough studies that we look, and all of a sudden, when we have 100 studies, if we see that there's a pattern, fine, right? The problem is there's no pattern, right? That's the problem. So what you have is just like really, fascinating data sets,
right?
But there's not clear what you can infer from it. So all we can do as scientists is say that you have a hypothesis about brain abnormalities, structural, functional, that has not been corroborated. You cannot rule out the null, in other words, right?
I think most people would find that surprising.
Yes, I think so.
Yeah,
I think I also know why.
Elaborate.
Because there's a very odd tendency. I mean, this is not only psychopathy research, but anything that has to do with brain sciences, and especially neuroimaging research. There's a tendency for media to really, really highlight, there's a new study from 2025 that analyzed the 20 psychopathic and non-psychopathic, and they found that there was, a structural abnormality in their amygdala. And that's fine if you found that, but all right, but what about the other 100 studies?
Right.
Like, did they find the same thing? Right.
Right.
So it gets kind of like, it's so sexy to talk about because it's so fascinating that you can just, put a person in a tube with a powerful magnet, and then all of a sudden you can get this
sort of seeing stone.
Yeah, you see behind.
Yeah.
And it's just not how it works.
Interesting.
You at some point you kind of have to just call bullshit. It's not to demean or minimize the impact and value of these studies. It's just that as a scientist, you just have to say we haven't found anything. We cannot say that there's for sure nothing. It's just that we haven't found anything.
Which is fine. It's too many scientists are chasing a positive result when a null result is just as good. Yeah, you've learned something.
Yeah,
there's no correlation.
It's not the incentives in the sciences.
It's not sexy as you.
And the scientists are also partially to blame for this. It's not just media. We have done a study in our group where we compared the actual results from raw studies to how it's being synthesized and reviewed in review studies, and we found that. We took just like a neat cut sample of structural imaging studies where the null ratio was, I can't remember the exact number, in the 70s. So more than 70% null findings, right? It's very high.
That's very high.
And when you go into the review studies, that has like shrunk down to 5%. So if you pick up a review article produced by scientists and you read it, because Yeah, I mean, what the heck are you supposed to do if you're a layperson or if you're just like, you know, a practicing psychiatrist? You pick up a review study. That's what you're supposed to do. And then you read, and then you're like, that's really interesting. They've really figured this out now, right? But the problem is that if you go read the studies, they haven't. So this is a phenomenon referred to as coding bias. So the people who transport the results from the studies into the review study, they make some sort of biased judgments, and you know, things gets lost.
Yeah, that's the impact of that can be very, well, obviously, very detrimental. And I mean, and if it's done deliberately, quite heinous.
So I don't think these researchers have any like
not making any sort of
they
claim.
don't have any bad incentives. I'm sure it's an unfortunate part of science. It's just really a problem when it's not just the science world that impacts, but here we talk about a diagnosis being used in the legal system.
Yes,
that's where that gets a little bit trickier. I should say it's very difficult to say how big an impact this brain research has on how the diagnosis is used in the legal system. It's not clear that it has any, like, we haven't found much evidence that it has like a direct, clear, like general impact. I think it more functions like something along the following lines. Oh, you've heard about psychopathy. Let's say you're a judge, or let's say that you're, you know, an attorney or parole board member or something like that. You heard about this thing, psychopathy. Oh, you also heard that it's corroborated by brain science, so it must be a real thing,
right? But then you know that Ted Bundy was a psychopath.
Yeah. So then you have it has this corroborating tend to it, right?
Yeah, but it's confirmation bias.
It creates all sorts of those things,
right? Very interesting.
But it's very hard to measure as science is what the impact of such information.
For sure. So all things considered, you're not convinced that psychopathy. Well, I don't want to put words into your mouth, but you're not convinced, not that it doesn't exist per se, but it definitely should not be used as in legal settings the way it's being used now.
Yeah.
And you use the term zombie idea.
Yes.
So what do you mean by zombie idea? Why is psychopathy ultimately a zombie idea?
So we don't know for sure whether it is in fact a zombie idea, but in my book, I this is probably where my background in philosophy shines through the books. I try to lay out, not necessarily an argument in favor of it, but at least lay out the reasons why we have rational reasons to suspect that it might be a zombie idea, right? So maybe I should back up and like say a little bit about what a zombie idea is. So zombie idea is this concept that scientists use sometimes to describe a certain type of idea that empirical science or empirical research has thoroughly falsified. All the evidence has been produced just like suggests that this idea is a nothing burger. It doesn't exist. Whatever the idea is about is just like not real, is false, whatever we want to call it, right? But it's somehow the idea just managed to walk around in the sciences and infect people, and people keep studying it, even though the entire empirical record suggests that you should not bother with this anymore. So the analogy, the metaphor is probably clear, right? You have this dead thing walking around that's very infectious, and it infects all these new upcoming scientists and so on, right? So zombie ideas are incredibly rare in the sciences. Like they really, really are. They're very common in ordinary life.
Sure.
So people love zombie ideas. Like we believe in all sorts of things that are just false, right? That's just the human condition, I suppose. But in the sciences, they're very rare.
The whole pursuit of science is to sort of,
you could say that,
to nullify.
But we're here to falsify ideas.
Yes,
and
exactly.
the ideas we are unable to falsify, we think they might eventually be something that looks like true ideas, right? That's what we do, right? So because science is such a powerful method to generate knowledge, at least it's the best one we have, or approach to evidence is the best one we have, and zombie ideas, just like false ideas, just get shot dead quickly, and they don't resurrect, and people just move away to other ideas, right? That's usually a pattern we see in science. Sometimes, however, for all sorts of poorly understood reasons, there are some ideas just slip through the cracks, right? And I wish I could give you like a long list of ideas, but because it's so rare, I can't. Right?
I'm trying to think of
If you were really trying to think about it, you would actually. I think most scientists would probably have to stretch. Most scientists come up with things that they might believe is false, or things that annoys them that other scientists believe, like small little things. But we're talking about grand ideas, right? So like real claims about reality, not like Bayesians who are arguing with frequentists about statistics, and it's not that. You're talking about like really bold ideas that survive, right? And I've tried to do some work on this, like outside of psychopathy research on ideas, and I've only really been able to come up with like 10, 15 in recent history of science. Maybe not even 15, if I have to be honest. Maybe close to 10. One clear case, though, just to give people a good idea, is the idea of biological race. Mm-hmm. So that's like is often an idea people refer to. So the idea of biological race is that the human species is something people believed all the way back to, gosh, I don't even know, 1700s or maybe even earlier than that. But, they believe that the human species has kind of like evolved into different, subspecies, and those we call races, something along those lines. It gets very more detailed later on in the history of science. Today, we think of race as some sort of social construct identity thing, right? To say that you're, Hispanic. Or
more of a qualitative description rather than anything else.
We don't make it like a biological claim. Right. And the reason why this idea got shot down probably at the point of no return, maybe already as early as the 1950s, when you start doing, genetic studies, and you realize there's not much difference, right? Of course, once you had mapped the human genome in the 1990s, completely, absolutely dead, right? But we knew way before that it was dead. But you still have researchers for at least 2-3 decades, and a large group of researchers kept studying it, even though all the research suggested there's no such thing as biological race, right? So that's the zombie period that we sometimes refer to. So you have a zombie idea. You have a time in history where if you are careful and reading the empirical research, you should know it's a zombie idea. Of course, science is very hard to say, when is that, right? Right. That's tricky. Right. But then, with the benefit of hindsight, when you look back, you can discern a zombie period where the idea was, in hindsight, thoroughly falsified, but kept walking around for years. Right? Mm-hmm. Usually that zombie period is usually not that long. With something like biological race, it was very long, maybe as long as 3 decades, right? So this is what I'm suggesting with that there's reasons to believe that psychopathy might be one of those ideas that, we have so much evidence to suggest that this is just false. There's no such thing as psychopathy, at least in the sense of a personality disorder construct. Right. Like all these things that Hervey Cleckley and Robert Hare and their colleagues said about psychopathy, the idea of psychopathy, we have so much evidence to suggest that that's just straight up false. Or at least we have invested so much research capital, human capital, into studying this thing. We're talking about hundreds and hundreds and hundreds of studies, and we have come out with nothing to show. To me, that's a powerful indicator that you're dealing with an idea that's just false. Mm-hmm. It's just not there. It is fantasies for Ghazi, right? It's nothing. But there's so many people who are interested in studying this, I would say you could probably, maybe history will show me wrong, but if I turn out to be right, I think maybe already as early as 2010s, maybe at least 2015, you would have known, if you were careful read of the research, that there's no evidence, right? So the claim that you're making, that I think it's a good claim. So it's well supported that psychopathy, the idea of psychopathy is a zombie idea. The implications of that are huge.
especially on the legal side, going forward, but also going back, the amount of people that are locked up and the aggravating circumstances because of that diagnosis. That would be a huge impact. And so one of the things that you've suggested is you call for a moratorium on the forensic use of the PCL.
Yeah.
I don't think I need to ask why, but you've basically made your case for it. But how difficult would that be to implement?
That's a good question.
And what of those people who are already locked up?
Yeah, I honestly, I'm not sure I have a good answer to it, but I can share some thoughts here on this issue. There's some positive things to report on this issue, and there's also a lot of negative things to say about this. But obviously, it goes without saying that if people are, like here referring to, forensic practitioners, if they're diagnosing people with something that like it doesn't exist, or at least, it's causing all sorts of extraordinary biases in decision makers, that goes against your human rights as a Canadian citizen, but also as a human, like also broadly as in most countries, you have the right for a fair process through a legal system. Most the countries, if not all countries, have that as a right. You cannot be discriminated against, and obviously such an assessment is doing exactly that. If you assume that what I'm saying about the research is true, I'm not just like misleading you, under that assumption, at least you should be able to recognize that this just seems to be wrong, right? It just also happens that it is indeed true that we don't have all this evidence to suggest the things that we say a psychopathy is true, right? As I've tried to lay out in my book. So what do we do now, right? Well, what we do is that we stop doing it. But, the legal system is a funny thing. It's not just something that changes overnight, right? There are hundreds of different institutions and practices, and people have all their ways of doing things. And even if you've removed the tool, like, for example, the PCL-R, and said, don't diagnose psychopathy, I can promise you people would still use the term, maybe just in a very unstructured way, and you can just see all sorts of
zombie would persist.
It's just like, it's the world we live in is not perfect, and it's certainly not perfect in our legal system. There's a lot of good things to say about, such as the Canadian legal system, but there's also a lot of bad things to say about it. We're working on improving it, and this perhaps gets me to the positive side. What I am seeing, and this is not carefully explored in my book because this is research that's been conducted after the book was published, but last year we published the largest study ever of Canadian court cases of how the psychopathy diagnosis has been used, and here specifically the PCL-R. And what we do see is that there's a steep downward trend. So it peaks around, I can't remember the exact year, I think it's 2000, maybe again 2013, and then it starts to slowly decline, and then all of a sudden there's like, it's kind of like comes off the cliff a little bit, and of course our data collecting went up to 2023. It could be that it has changed after 2023, who knows, but it seems like, at least in the court system, that seems to be on a decline. Whether parole boards still use it, whether parole officers still use the information, whether different psychiatric forensic institutions are still using it, that's still, like unknown, I suppose. I have all sorts of anecdotal evidence that is conflicting when I talk to colleagues. Some people say, yeah, it's still used on a daily basis. Some people say, no, it's not. So it's very hard to get a good grasp of. But when I look at the world, at least when I go to conferences internationally, it does seem like that at least the countries we compare ourselves to, such as, for example, United States, European countries, UK, Australia, and so on, it does seem like it's on a downward curve. Again, whether that's fully positive, I don't know, because maybe, people are still just using it informally and not necessarily as a formal assessment, right? So I would hold my horses in being too positive on this, but I do think that we see it. Something that also really makes me positive is kind of like the other side of that token there. When I see the upcoming generations of forensic psychologists and psychiatrists, I think they're way better trained in incorporating nuance into their assessments and interpretations of their clients, right? So there's a lot of focus on trauma-informed practices, understanding that the person who sits in front of you might not be this callous, person with no empathy, but this actually a person who's trying to maybe shield themselves. They have maybe exposed to all sorts of traumas in their life. They're not here to cry their heart out to you, but they're here to do something else, right? And so there's much more nuance being incorporated in education today. I think that's largely what was missing. If we go back, we want simple explanations for what seemed to be simple behavior, right? But it's not. Like, human behavior is damn complicated, even criminal behavior.
Very complicated.
Yeah.
And, I'm trying to think, somebody like Ted Bundy, how would you approach that situation if you were to remove the PCL-R and the idea of psychopathy? Would it really change anything at the end of the day? It wouldn't in terms of legal outcomes for somebody like Bundy.
No. I mean, Bundy is, of course, a very extreme case.
Yes.
And unfortunately, they pop up once a decade or something like that.
Right. But I guess that's the point. It's important to note that that is an extreme case.
Serial killers, they get, usually confined, either civil commitment or incarceration for the rest of their lives, just because they rake up enough life sentences to stay locked up,
right? Or
they were so severely mentally ill that they need a civil confinement and they need treatment, right? So they usually just fall into this. In none of these cases, a PCL-R assessment or a psychopathy diagnosis is going to be helpful in any remote way, right? Right. So these cases, they're kind of novelties and not necessarily. Also, it's not necessarily what we talk about either. We're talking about, according to psychopathy researchers, like a good chunk of the justice-involved population who are supposed to be or alleged to be psychopathic persons.
So you're talking about the 99% of the 1%.
No, we talk, if you like common claims, I think these are, of course, false, because I don't think there's such a thing as psychopathy, right? But if you take a prison population, right, for example, it's somewhere between 20 and 30% who will score above or around score 30 on the PCL-R.
That high? Yeah,
it can be that high in some. It varies from institution to institution, but it can be up there, right? So there are studies that does this, that just go in and just to gauge what's the extent of this, right? Now, these individuals, so what you're asking me is that if we remove the PCL-R from how we generate information about these individuals, what would happen, right? And this is probably the strongest reason why, or case in favor of removing the PCL-R, is that the PCL-R, if you want to predict these individuals in the justice system, or let's say in a correctional facility, if you want to predict their future behavior, in other words, if you want to be able to figure out who's going to be the high-risk person and who's going to be the low-risk person, the PCL-R is actually a very poor tool to do exactly that.
Right,
so we have much better tools around today, because it turns out criminal behavior is a complex product. Right. It's a product of substance misuse, trauma, all sorts of other mental health disorders that we know a great deal about. It can be organized crime. It can be all sorts of things, right? So we have tools that are kind of designed for these different scenarios, and they outperform the PCL-R all the time. Now, that's not to say that these tools are great. We still have a long way to go to predicting risk. And there's a strong case to be made that forensic psychologists have nothing to do here in this field, because we're still not good at it. I don't necessarily share that view, but that is a view that people have tried to defend. Now, but the PCL-R and the psychopathy diagnosis is never going to give you any incremental utility in this whole situation here. And if you pair that information, this is completely uncontroversial, by the way. Anyone in risk assessment, in the field of risk assessment, they would agree with me on this. This is just like looking at numbers and nothing else, right? So we have plenty of studies that just like rates these scales, and the PCL-R is not in the bottom, but it might be like floating around somewhere in the middle, depending. If you're trying to predict sexual recidivism, it's way down the bottom. It's like flat out, don't use this tool. This is actually irresponsible to use. But if you want to predict something general recidivism, it's there in the middle, floating with other tools. But there are better tools available. But what I want to say is that if you pair that information with the fact that the PCL-R takes much longer time to conduct the assessment compared to other tools, is a massive resource drain. You literally have nothing to lose. Like, in fact, institutions who are providing these services of making these assessments or other scenarios these are used, if you are investing resources in PCL-R assessment, it could be a Crown attorney or something like that. If you really want to be real about it, there's a much better way, or much better, more efficient use of resources, right?
That's an interesting perspective or way to look at it.
Yeah.
Resource-wise. Now, just back to the zombie idea real quick. Why do zombie ideas persist? Something that I didn't know was that, and correct me if I'm wrong, the PCL-R was owned by Hare in terms of a copyright or a patent. Well, I don't know which one. Copyright, right? And then he sold it to a company. How much of the zombie idea is linked to financial motivations, do you think? Is it possible? Because I think of other zombie. No, I can't. Like, it's hard to think of zombie ideas, but I think of something totally out of context here. But sort of, I don't know. Are you a fan of Egyptian history?
Yeah.
Yeah. Like, how are the pyramids built, right? It's, Hawass, for example, he's written a lot of books that claim a certain narrative that he relies on for an income, and that's fine. We all need an income. Yeah. Something similar happening here?
So you're asking me how much of this, the use of the PCL-R is driven by careerism and financial.
Yes.
With the risk of being burned at the stake by my colleagues, I do think is one of the worst kept secrets in like, if you go to conferences, you will hear a significant number of people speculating this is exactly what's going on. That the PCL-R is a type of service that you can provide. As, let's say you are a psychologist practicing as private practice, and you do assessments for Crown attorneys or something like that. Let's say that you do that, right? You need to have a line of products that you can offer, right? And one of them can be the PCL-R, and the PCL-R takes a long time for you to produce, and you have a big history and a big literature where you can argue that they are important, because the Crown is not going to know better, because they're not. I mean, I'm not blaming them.
I'm coming to you. You're the expert.
To me, I'm the expert. Like the psychologist would say, and the Crown is just like, I just want an assessment, and it's not. The payment's not coming out of my pocket. Right. It's like, so, and this is going to be, Crown attorneys also love this. I shouldn't say it that way, because I generally think Crown attorneys are really full of integrity. That's my only experience. But there are definitely some Crown attorneys who might be tempted looking at this and saying, this is a very powerful assessment to bring to court, because it tells a lot of like narratives that's going to corroborate my story about why this person should be, given a correctional sentence or something like that, right? And I don't necessarily mean to say that there's foul play here, because the Crown attorney is within their reason to believe that what they're being told is true, right? So they're not really at fault here, right? So, but you can see how it's a powerful tool. It is, by the way, only Crown attorneys who uses the PCL-R in the court system, for example. It is virtually never introduced by the defense, right? But anyway, leave that aside. You make thousands of dollars on one assessment of an individual doing a PCL-R assessment. And I know, like anecdotally, of course, that people live up this, right? Now, you're asking me how much of that exactly is then keeping the field alive. That's very hard to say.
Of course.
But I do sometimes speculate whether the whole thing was, in no small part ignited by exactly that incentive. I remember one of my colleagues writing me, there was a very like a searing review being published in some half obscure journal about my book, where some person that might have published 1, 2, 3 studies in psychopathy research just like tore into my book with like a 2-page review, completely misrepresenting everything and just like saying it was basically the worst thing since the last plague or something like that, right? And I remember my colleague writing me and said, "Oh, the PCL-R syndicate is strike back," like that. And and it's fun, and and that's really just all it is. It's not there's no like larger syndicate behind all of this, right? I see the incentive to make money, but I don't think they have much pull. They certainly don't have a pull on me and what I do as a researcher. Of course, it bothers me, but I think it's clear when you sit at a conference, as you can imagine, I've done many times with people and discussing these things, and there's often going to be a diehard psychopathy researcher among the crowd, maybe a diehard PCL-R defender. It's basically my uniform experience that person stands out as the oddball in the room. It's like just anecdotally, I was in Finland, Helsinki, Finland this summer, where I participated in a roundtable about exactly this issue. Should we use the PCL-R in legal settings, right? And the panel was set up as if it was like people who were defending different types of views. Like
a debate. But
it just ended up being that, all the panelists, myself included, were just like basically fundamentally against the PCL-R. It's almost 2 different worlds compared to 10 years ago. 10 years ago, that would have been completely unthinkable to have a panel like that, let alone like have 3 panelists basically ending up agreeing that you shouldn't be using this. There was no, at least not what I could discern, resistance in the room full of, I don't know, 200 or 300 people, right? Like that was 10 years ago. If you submitted a conference paper that was just slightly critical about the PCL-R as psychopathy, that would just been straight up rejected.
Very interesting.
Today, very different. Yeah.
Something interesting that I heard you discuss was the idea of genocides, and not necessarily the leaders of genocides, but the people who conduct them day to day.
Yeah.
Which could be seen as psychopathic behavior.
Yeah.
But these are people who go home at the end of the day. I mean, it's just a brutal concept to even be discussing.
Brutal. Yeah.
But these people do go home, like I heard you say in an interview recently, kiss their children goodnight, say I love you.
Yeah.
So why are those people not psychopaths?
Yeah. So for exactly that reason.
Right.
Right. So now I do recognize, I don't want to be blind to that I do think a lot of, ordinary folks would say, but that's what I'm talking about when I say psychopath. And here I just want to say that's not what we, and by we I mean not the royal we, but like scientists who are studying psychopathy, that's not what they're talking about. They're not talking about the trivial observation that normal people can do bad things, even if it's very bad things. That phenomenon we're talking about, where a person, there's great literature on this, but where a person, for example, participates in murder groups during genocides, goes out and kill 10, 20, 30 people one day and go home and kiss their children goodnight and have a loving and caring relationship with their wife or husband or whoever we're talking about. That is a fascinating thing. I'm not saying that. It's horrid. But it's a fascinating aspect of human psychology that's possible. But that's certainly not what we're talking about when we say psychopathy. Here, we're talking about that the person has no capacity for a loving, caring relationship with a wife, or let alone have any interest in having a loving, caring marital relationship with children, for that matter, right? That's the situation. I think that's just like obvious to see why those are 2 different things. Just not to demean to degrade that the other thing is not interesting. Of course it is, right? But I think this is actually, to me at least, this is when I started to become skeptical about psychopathy research. It actually started around that conversation. I know that I sometimes give different origin stories of my skepticism, but this is the honesty is that it's a process where you develop your skepticism. But I remember vividly, this might have been in 2013 or something like that, where I was deeply invested in this genocide literature. I've been obsessed with it because it's so detailed. And what always struck me was, like, how the heck can you do something like that, right? Mm-hmm. And I remember one of my professors just want to say, "Oh, it's because they're psychopaths. They're sick. Like that. This is not normal human behavior." And there's just too many examples of it that I was kind of like getting to the point where it's like you have to kind of make room for this within normal human behavior. Right. So when you go and research genocide scholars, this is exactly what they're saying. So I'm not like inventing this like by myself. I'm taking this from having engaged with this literature. That's what they think is so terrifying about genocides, is that genocidal acts are it's something we can go there with such an ease. Now, people might go there through different pathways. Some people obey orders, some people pursue it for careerism purposes. There's all sorts of different avenues, but you nevertheless end up doing the same act, and you end up with having maybe some moral injury and problems with your conscience, but most people get over it quite quickly, or live with it at least, right? And becomes just part of their lives. And some people even rationalize it, make it sound like, they were doing something good, right? It's terrifying, is a terrible act I did, but I did it for the greater good, so they came to that act through like a moral reasoning all of a sudden, right? You see this in how like top Nazi generals and people in the upper echelons of the National Socialist Party in Germany, they actually we have this caricature understanding of the genocide and the Holocaust in Germany in the 1930s and 40s, but it's much more complicated once you open it up. A lot of the top generals are saying we have to take this horrid burden on ourselves to make the world good.
Right, I'm doing it for you. Right. Now this grave, like, evil act is like portrayed as like a moral act. I just think it's so sacrifice. It's just fascinating that human beings can go there, and you just have to, as I said, you have to incorporate that within your concept of normality when we talk about human psychology. Now, and this is this is how my skepticism started. I was like starting to realize maybe people are just getting normal psychology wrong, right? Like in this field, maybe they're actually just, they see this bad behavior and then they try to make sense of it. It's because they have no conscience or they have no empathy and so on. But no, you don't see that when you read this. Like, and then when you do empirical studies, you definitely don't see it, right? So it's fascinating because there have unfortunately been so many genocides and acts of mass killing, and it's safe to say that there are people walking among us that have been a part of those things. So many people have been a part of these things, and either they get over it, they forget about it, or they rationalize it. That is a fascinating phenomenon. Now, what would you say in regards to the people at the top of these genocides? Stalin, Hitler, Mao, Genghis Khan. Are these psychopaths? How would you portray them? Yeah, so again, like, I think most ordinary people would just say, of course. That's right, but again, like if you want to be serious about it, you have to go in and look at these individuals. Of course, we don't know anything about Genghis Khan in that sense, right? But we know a great deal about Stalin and Hitler and whatnot, right? And you just don't find a person who matches any of the stuff that Cleckley and Hare talks about. Hitler, no emotions? Are you kidding me? No, right, sure. Good
Stalin, extremely paranoid, right? Obsessed with power, right? Like craving is a human emotion, craving power. No way. Like
families, children, wives.
Yeah. For crying out loud, Hitler was a vegetarian because he thought it was, couldn't bring it to himself to to kill animals.
Yes.
But I guess some human animals were free, right?
Right.
But no, they don't even like in a remote sense fit the label.
That's interesting. I think people would be surprised to hear that. But if we just, based on everything we've talked about,
I don't think it should be controversial at all. Yeah. I realize that I don't think it's controversial among right. I don't think it's controversial among behavioral scientists. I think it is controversially culturally to say that, right? But that's because we have different connotations put into the concepts, right? I do want to mention briefly though also that I juxtapose this up against, ordinary folks' understanding of the concept of psychopathy. But there's also been a little bit shift in certain branches of behavioral science where they have taken the concept of psychopathy and kind of like watered it down. And so we usually refer to this concept drift. An analogy would be that, attention deficit disorder, it was like really reserved to people who just like literally couldn't focus on anything, right? And now it has like been watered down, and now everybody has ADHD,
right.
So some people, you could make the argument that there are certain circles in the research paradigms where people have abandoned essentially the PCL-R and Hare definition of psychopathy and watered it down, or at least changed it to something different. I do see some of my colleagues making that argument, but that I usually just frame it in my book, for example, I frame it more like as a debate about what psychopathy should actually mean. And again, it's just a sign of weakness that after all these years, there's still debate about the conceptual definition. And so you could also look at it that way, right? But I do want to say that there might be some psychopathy researchers that students meet at colleges, universities that say, no, here you can take the self-report and I can put you on a scale. It's just one big continuum. And, the outer edge of the continuum is just like people who really just don't care about anybody else but themselves. No, that was not what psychopathy was. If we're talking about a psychological dysfunction to the degree of personality disorder, right? Like it has to match those definitions, right?
All right, I've got 2 or 3 more questions for you, if you don't mind. What would be your advice to students who are interested in this topic, who might be starting an undergrad or even graduate work, and are hearing this for the first time and are thinking that's very interesting? Where should they start? What would your advice be in terms of how they should pursue their studies going forward in light of the fact that things are changing?
Yeah, I have several advice I would like to give. And the advice will be different whether I'm talking to an undergraduate or a graduate student. But, as you can imagine, I get a lot of people, so a lot of incoming undergraduate students who wants to study psychopathy. And they read, the headliner on my resume that I study psychopathy, and they assume that I just do that in the ordinary fashion, of course. And they come in, is by far the most sought after line of study that I see. People come into forensic psychology. I teach introduction class to forensic psychology and so on. They come in because they want to know about serial murderers and psychopaths and so on. And it's I crush a lot of dreams already there because it's more complicated than that, right? And I think people get scared away from that, but that's fine, right? If you really want to study forensic psychology and you really want to understand criminal behavior, for example, and understand how people refrain from or desist, as you call, from criminal behavior, you should study that. And there are many different angles you can do that. Well, there are many other things you can do as a forensic psychologist, but I would not advise you to study the role or study psychopathy as a personality disorder, believing that this is something you can pursue. That is not so relevant as an undergraduate because there's going to be many years before you even do research. Sure. So please feel free to read whatever you want to read. But if you want to read about psychopathy, you should do yourself a favor and read also the people who criticizes. I'm not the only one, but I have written a book about it, so you might want to start there. If you want to continue studying that, you need at least to have a good response to what critics are saying. That goes for any area of study. Absolutely, right? Yeah. Graduate students, however, I would be very cautious, because if the curve I told you about is up 2013 nosedive, in the sciences we refer to that as the generative research paradigm. This is a term coined by Imre Lakatos. It means that this is a signal that researchers are abandoning it. So there's no future here. This is when psychologists especially start believing that something has been falsified. It's not like if we put on a conference and talk about wrong.
Yeah.
We just quietly walk away.
Move on.
Yeah. And research output is your number one indicator that people are quietly walking away. So if you want to base your career on this, you better have some really innovative stuff to say. And if we're talking about a field with hundreds and in the thousands of published articles, people have probably already said what you think you're going to say, right? So you have to figure that out first. Well, if you want to find out, you can always contact me. I have a massive database on the research, so we can find out if that exists, right? But I'd be very careful. I'm very careful about that.
I think that's very good advice. And finally, what would your advice be to the clinicians, the prosecutors, the lawyers, the people in correctional facilities? What would your advice be to them moving forward? I know a lot of their hands are tied. They do things that are prescribed to them, but what would your advice be?
I mean, I recognize that different practitioners are in different binds. I hear that some institutions demand of their practitioners that you do something very difficult to go up against an institution. It shouldn't be the institution that tells you what assessment to do, but that's how it works sometimes. So it's hard to give like a sweeping, good generalizing advice. But if we talk to the clinical people on the clinical side, at least, and generating information to decision makers, such as, for example, PCL-R assessment, right? My advice would be, first of all, you're fully within your professional bounds to decide what is the best assessment tool. It's not for me to state. I'm a firm believer in evidence-based practices. Evidence-based practices include science, but that's only one leg. The other leg is that you have to listen to the person who's your client. That's also evidence. And the third one is your own personal experiences. Now, science is all I'm talking about is the science part. There's two other elements to it. It might be that clinicians say, I have all these unique ways of using the PCL. It's been very helpful for me. All right, that's fine. To those who are in doubt, I would say that you should always be careful when you have evidence lacking on the science side. That is usually not a good sign. I'm not here to tell you, but be careful. I do also have something to say about the ethics of doing this. We haven't touched on this, but I do think you can make a powerful argument that is actually, again, your clinical, professional, ethical guidelines. So clinicians have codes of conduct, basically, like, for example, do no harm, right? But there are many other things that you're committed to, depending on country and so on. But I would advise people to review that, like, critically, like, is this actually conformant with the professional expectations of my discipline? I made an argument in my book that it's not, and I think it's pretty I think it holds up. It might not be completely airtight with every scenario, but I think is something to consider. To the Crown Attorney, I would say stop ordering PCL-R assessments. To the defense attorney, I would say you have a very good way of challenging this in a VODAR. So you can just, what you would call discovery or whatever legal systems you're operating in, you can straightforwardly challenge this will, if you give the right person 10 minutes to talk to you as a defense attorney, you can get the PCL-R, I would say, probably thrown out immediately on Mohan criteria or Daubert criteria in US, Canada, right? So those are the criteria that decides whether expert evidence or expert witness evidence is allowed into court. And these are governed by the Daubert standard in directly in the United States, but also partially in Canada. But in Canada, we have the Mohan criteria. And one thing that is central to these criteria for when judges decide is the issue of reliability. The other criteria also, but the issue of reliability is a big one. And what we have found in studies is that the PCL-R is very unreliable in adversarial settings, so in court settings, meaning that raters literally do never agree on the score on a person. Now, what ends up, there's a lot of complex things that happens when you have that conundrum to deal with. But one thing a judge can be certain about is that whatever score that they're being given, say score 29, they don't know if that score is really a 21 or really a 34. They just literally don't know. In other words, the information is junk. You cannot use it to inform your decision making. It's just going to end up biasing you. So back to what the defense attorney can do. You can challenge this. You really can. It's disturbing that it seems like very few are. Of course, it can be difficult to track that data because that might not be written into the court records and so on. But anecdotally, it's my understanding that it's very rarely challenged.
Fascinating.
Yeah.
Fascinating. Psychopathy Unmasked, The Rise and Fall of a Dangerous Diagnosis. Where can we get your book? Where can we learn more about your work?
Wherever books are sold, I think you should be able to get it. Yeah.
You have any social media website?
Yeah, there's a psychopathyunmasked.com, but they can also follow me on LinkedIn. This is probably where I'm most active. Yeah.
This has been absolutely fascinating. So much to think about going forward. And thank you for joining me. It was an absolute pleasure.
Thanks for having me, Ted.